Next, we'll hear from Lauren Kennedy-Metz. Lauren is a postdoctoral research fellow affiliated with the Department of Surgery at Harvard Medical School, and she works in the Division of Cardiac Surgery at the VA Boston Healthcare System in West Roxbury. Her presentation is titled Development of a COVID-19 Cognitive Aid to Support Operating Room Personnel. Lauren?
Thank you so much. I'm excited to share this work, which is funded by the National Heart, Lung, and Blood Institute of the NIH and led by Dr. Marco Zanotti, and represents a long-standing collaboration among the following labs. Dr. Zanotti leads the Medical Robotics and Computer-Assisted Surgery Lab at Harvard Medical School and the Division of Cardiac Surgery at the VA Boston, and this lab includes myself and Annette Phillips. Dr. Roger Diaz leads the Human Factors and Cognitive Engineering Lab at Stratus Center for Medical Simulation and Brigham and Women's Hospital. Our UMass Amherst collaborators of the Laser Lab include Drs. George Brunin, Lori Clark, Lee Osterweil, and Heather Comboy. And finally, Dr. Julian Goldman leads the MD Plug and Play Lab at Mass General, which also includes Dave Varney. And the work I'm sharing today is the latest project that has been developed through these interdisciplinary teams, which brings together human factors, computer science, and cardiac surgery. And it's built off of substantial prior work by this group. On the next slide, we'll see some of the motivation. The additional protective measures that have been mandated by COVID-19 create a cognitive burden for surgical team members. And furthermore, additional stress on the team is caused by the potentially devastating consequences of missing steps or committing an error. The ultimate impact of committing an error in this case is not only reduced safety to the patient, but also reduced safety of the entire surgical team, given the increased likelihood of exposure and infection. In major surgery in particular, and namely in cardiac surgery, this impact is heightened given the reliance on aerosol generating procedures, which further increases the likelihood of viral exposure to the team. So to offset some of this additional cognitive load and stress, we propose a COVID-19 specific cognitive aid, the COVID-19 Surgery Support System. This system is being developed to support operating room personnel in the adoption of new procedures, building upon prior research that has identified excessive cognitive load as a key cause of the commission of errors that reduce patient safety. On the next slide, please. Development of this system is currently underway, integrating COVID-19 specific considerations into existing OR process models that are then used to automatically create context-sensitive or smart checklists to provide real-time guidance. On this slide is an example of the required steps for select provider roles when preparing the cardiac operating room in the current pandemic climate. This image shows the meat of the checklist. In the expanded form, you can toggle which roles are visible at any given time. And you can see here that each team member has their own set of steps and their own checklist to follow, but they're also often intertwined with checklists of other team members. Our goal is for these checklists to be utilized by taking into account the universal precautions with all patients in the current climate. And we are identifying these emergent COVID-19 specific considerations through published guidelines, novel protocols developed by surgical departments, feedback from subject matter experts, and interviews with end users. Next slide, please. We expect to see a change in team members' cognitive load and improved safety primarily for the healthcare providers and secondarily for patients as well. We also expect to see a long-lasting impact given that the protective policies imposed by COVID-19 will not go away anytime soon, and new staff members will face similar challenges that current staff members are facing today. Furthermore, the methods utilized in our approach are not restricted to COVID-19 or this context, but rather can generalize to create smart dynamic checklists across domains and settings. We envision this being a tool to facilitate adapting to ongoing changes through medical simulation and/or mental practice approaches in the short term and real-time guidance in the long term. So thank you so much for your time, and I'm happy to take any questions with the time we have left.
Lauren, thank you. We are getting a few questions, and I want to remind everyone attending, please continue to use the Q&A function. We're getting some good questions. Lauren, when Ariadne's work around checklists has really shown that the checklists are so much more than a reminder system. but they really help to improve teamwork and situational awareness and culture. How do you think this will be the same here?
Yeah, thanks for bringing this up. The work that your group has done with checklists is actually such a great example of leveraging medical simulation approaches to effectively evaluating checklists while maintaining a balance between experimental control and introducing a realistic setting. And we plan to similarly use medical simulation to evaluate the effects of our checklists on various outcomes. And so in response to your question, the short answer would be yes, that we would expect to similarly see a benefit beyond just checking off the boxes and going through the motions, but on a larger scale, an increase in individual and team level situation awareness, as well as teamwork to improve with the use of our checklists. And this is something that we would be evaluating using a number of behavioral taxonomies and self-report and observational measures.
Thank you so much, Lauren.
Thanks.